The thing about retinoids is that in many people, your skin can learn to tolerate it. If you're using a gentle retinol and you're doing great with it and you're done with the tube or bottle, then consider stepping it up slightly with your next one.
You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. On this episode of the Dr. Tyna Show, I am sitting down with triple board certified dermatologist, Dr. Mamina. She is my go-to skin girly. I found her on the Instagram. You probably know her as Dr. Mamina over on Instagram and TikTok. She has a huge following, but I found her during my journey of the middle-aged skin change. It happens for you in perimenopause. And so you middle-aged ladies and men, this episode is for you. Things shift as our hormones shift. Our skin health is completely dependent on our internal health. And we discuss all of this because Dr. Mamina is very holistically minded, which is one of the reasons I like her so much. We talk about your skin barrier. We talk about skin care and how it needs to be simplified and how all of these multiple steps are often very unnecessary. We talk about peptides and stem cells and skincare. And we talk importantly about retinoids. I think this is a conversation that I wish somebody would have had with me early on when I started playing around with retinoids. I share my entire story. I share how I really got into a fiasco with these. So I hope you enjoy this episode. I think you'll find it very informative. It is the middle-age guide to skincare. So without further ado, let's jump in. Dr. Mamina, thank you so much for coming on the Dr. Tyna Show today. I'm so excited to have you here.
Oh my gosh, thank you so much for having me. I have been a fan, so this is a dream. Thank you.
Well, I'm a fan of yours too, and you were so kind to have me on your podcast recently, and we had a good time, and I thought we got to get you over here. So All right. So we got a lot to cover today. And we talked about this beforehand. So you agreed. I'm not picking your brain here, but I am going to share a little bit of my backstory for the audience because I think that my story is really relatable. And I want to make sure that they understand that some of these changes that are happening within their skin. We're going to talk about skin. You are a world famous dermatologist. Your Instagram is huge and amazing. And I actually followed you for years before you had me on your show. So I was like fangirling you.
Oh my gosh. Vice versa. Like same here. Yes.
So you're a dermatologist. Tell us what you specialize in. Like what kind of dermatology? What's your favorite part?
Yes. Well, I am a general dermatologist. I do both medical dermatology and cosmetic dermatology. The majority of my practice is medical dermatology, but I have an overlying huge interest in taking an integrative approach to skin health. I'm really interested in just holistic dermatology. So when a patient comes in, I practice a lot of conventional dermatology, but I do like to look at somebody's diet. If somebody is concerned about prescription medicines, we'll talk about supplements that can be helpful. And we'll talk about other lifestyle factors too.
I love it. That's why I wanted to have you on in particular, because I know that you get it. You get the integrative approach. And I think that that's a huge part of skin health. I mean, your skin's like a mirror to what's happening on the inside, right?
It definitely is. That's actually one of the reasons why I was drawn to dermatology. I was planning on going into primary care and then doing an integrative medicine fellowship after that. And when I was doing my internal medicine rotation and saw these patients with autoimmune diseases, specifically like lupus and dermatomyositis with these skin issues, I was so drawn to them. And I was like, I could see that the skin is such a representation of what's going on inside.
100%. So my whole shtick was always, if your skin is a mess, then your health is a mess. I firmly stand by that. And when patients would come in and say, what have you got for acne? I'm like, well, your acne is the least interesting part to me because to me, that's a symptom, right? That's just an outward expression of what's happening on the inside. And so we would do the full kit and caboodle, the hormones, the gut, the whole thing, run all the labs and sort it out from there, often gut related. But I started having a funny situation happen. And this is actually when I found you because my skin exploded on me a couple years ago. I was living out here in the country. I live around a ton of acreage I'm moving to Arizona, as everyone knows, but I currently live in the grass capital of the world, the Willamette Valley.
Oh, yeah.
So it's all grass grown out here, and it's grass grown for grass seed for golf courses and stuff. So
literally grass.
Country. Okay. Yeah. So the natives called the Willamette Valley the Valley of Death because the allergies out here are so insane because of all the grasses.
Oh,
So I
wow.
moved out here, my first summer out here. It also happened to be like COVID time, and I was sort of pushing back on the narrative and having a lot of stress. So I was having a lot of stress during those days. But the skin issue cropped up, and I did not know what the heck was happening. And it started with this like prickly rash. Mind you, I'm just halfway into perimenopause, kind of at that point. I'm starting to realize that the hormones are a little wonky. But I get this prickly heat rash, and my mom had rosacea, and I started to see it, and I was like, "Oh no, this is very characteristic of what my mom went through." And that's when I found you. I went digging
Oh.
for all the dermatologists online because I was like, "What is happening? I need help."
Yeah, yeah.
So anyway, is that a pretty common thing that happens in middle age? Do you see
We
skin conditions pop up?
Yes, we do, especially if there's a genetic predisposition. And, just because you have a genetic predisposition does not mean that you're sentenced to have this condition, but you're just more likely to present with it. And we definitely can see it present later on in life during perimenopause, menopause. And a huge part of what rosacea is, or just if you just have a compromised skin barrier with sensitivity, it's related to the skin barrier. People with rosacea prone skin, their skin barrier is a little bit different from the average person. Your skin is also more reactive than the average person. Your vessels will react more readily to stimuli. Part of that's genetics. Part of that is also there's a big interplay with your immune system and your gut health too. But the skin barrier is the biggest thing that we focus on in those with rosacea. That's the first thing we try to address. And when you're going through perimenopause, menopause, your skin barrier is also starting to get compromised. Your epidermis gets thinner. There's less oil production. And, oil, sebum, that's a huge part of your skin barrier. There's like lipids, proteins, your microbiome. Those are all components. And when there's like less lipid production and when there's like a thinner epidermis, you're definitely going to see more issues with your skin barrier.
Okay, so it was like the perfect storm then, because I had this immunologic reaction to all the grass that was being grown around me. And then that winter, I went to Mexico and I picked up a parasite. I got an amoeba. So I came back really sick. So my gut was a mess. My allergies were going nuts for the whole summer. I mean, harvest season out
That
here
makes
is like
sense.
something else, and there it was. And I was like just ripe for it with the hormonal shift.
Yeah, yeah. No, you had the perfect storm, it seems.
Yes. And
Yeah.
autoimmune disease does creep up also as the hormones shift for women. So it's just I saw that a lot in practice too, that middle-aged sort of skin out of nowhere, perfect skin turning into just, I don't know, troublesome skin for women, and they're like, what the heck is going on here? So
Yeah,
yeah.
definitely. And what you brought up, the parasite infection, yeah, disturbances in your gut health. We definitely see in studies that SIBO has been seen more so in rosacea and another bacteria, higher rates of H. pylori in those with rosacea too. But essentially any kind of disturbance in your gut microbiome, there's a correlation.
Yes. So then the third part of this is I was getting all of these wonderful products sent to me by lovely companies who make natural products. So all natural skincare, lots of essential oils in there. And I went from like the girl who used Dr. Bronner's on her face. That was about as extensive as my skincare routine was.
Uh-huh.
Like no moisturizer, just Dr. Bronner's, never wore
Wow.
sunscreen, I was
Yeah.
just raw dogging it. And then
Yeah.
I start applying all of these different steps of all these different natural, and I'm trying all different kinds of things at once.
Mm.
Total disaster. Like my skin my eyes. Oh, and I had fake lashes at the time too. So I got this terrible allergic reaction to the eyelash glue. My skin was like a prickly heat rash. My podcast producer, I'd have to call him and be like, I can't do the podcast today because you should see my face. It's it's a mess.
Oh my gosh.
So
Yeah. So there's a lot of parts to that. Whenever introducing new products to your regimen, we tell people 1 or 2 products at a time. And then there's this whole sphere of like, quote, natural products or products that have potentially like less toxic ingredients in it. And that's a whole conversation. I think dermatologists struggle a lot with that because we say, well, poison ivy is natural, but that does craziness to your skin. And I'm a hippie at heart. Like, I totally understand the attraction towards products that have like minimal ingredients that could potentially be harmful, um, internally and whatnot. But something that we do see so much as dermatologists is reaction so easily to these products that potentially have like that are worse for the skin. So essential oils, and there's some great ones out there, of course, but there are some that are just so terrible and irritating to the skin, especially if they're in like the citrus family. Even tea tree oil can be really irritating, and bergamot, and we see a lot of cases of like irritant contact dermatitis from essential oils. So we're very cautious about those ingredients. We're all about like minimizing even fragrances in products and even extra botanicals. There's a lot of amazing botanicals that have wonderful antioxidant properties and skin nourishing properties. But like if you are starting off with a regimen and you're trying to work on nourishing your skin barrier, we say just keep it super basic, like with just a very simple moisturizer and a gentle cleanser.
Well, I learned my lesson, and I have since turned away a lot of money from skincare brands because I'm not going to take your offer. Either the product caused me a rash. It's not their fault. It's my crazy immune system. But I have turned down many, many, many brand deals because I'm not going to promote something I don't use or that I don't love. And I'm not even going to risk trying it, because where I have ended up is straight up Vanity Cream Daily Moisturizer is the best.
We love that one so much.
$10 and it's so good. And then I think a CeraVe cleanser, a gentle, creamy cleanser, which I've also adapted to my hand wash. I have that as my hand wash everywhere too, so my hands don't crack in the winter.
Yes. I love CeraVe. Yeah, CeraVe is a hand wash.
And then La Roche-Posay has a couple products I really love. And the Cica Blast that they have, that Cica Blast balm, like whatever it's called, slugging, I guess. All of that. I think I just love the dimethicone. Is that what the ingredient is that I'm?
There's some dimethicone, but there's also zinc in there, which is soothing, and panthenol. And then, so that's what the B5, it's Cicaplast Balm B5, and it's a panthenol, which is soothing. And then Cicaplast, it has Cica in it, Centella asiatica, which is a wonderful soothing ingredient, but also bonus points. It also is nourishing to the collagen. It can help with collagen remodeling and also help with potentially wrinkles too.
Oh, nice. Okay. So that's my regimen. I am a drugstore product girl now, and I love it. I can get it anywhere I go. And it's so easy on my skin, and my skin healed, and I quit messing with my barrier. I think I destroyed my barrier. And then of course, what do? You get the prickly heat rash, so you start to exfoliate harder.
No.
Let's talk about that. Let's talk about the over-exfoliating of the world.
Yeah. So the purpose of exfoliation is to assist your skin cells with their turnover. As we get older, so normally our skin cells turn over once every 30 days, and it just gets a little bit more sluggish as we get older, and that presents more so with like dull skin, sometimes a little bit of flaky skin. And so exfoliation, of course, there's a purpose and a place for it, but if you're having flaking because of a compromised skin barrier, not because it's like a buildup of skin, but if it's compromised skin barrier, then you definitely don't want to exfoliate, because your barrier is, it's almost like, I'm trying to figure out how to say it. Too much barrier is like, we're trying to help keep your barrier at a good level where it's not too thick, not too thin. But when your barrier is compromised, it's too thin. And so exfoliating is going to just make it more compromised.
Yes. I just turned it all into a big hot mess. That's when I found you. I was like, I'm following these genius dermatologists and you all kept saying the same thing, which was this really basic skin barrier concept. And I was like, duh. I mean, it's all about, duh. Cause I treat internally, I'm trying to balance the guts barrier, if you will, right? That's my goal is always to calm and nurture that gut lining so that
Mhm.
we don't get so much immune reaction from a leaky gut. And it's kind of the
Mhm.
same thing with your skin. I was just creating like
It is.
leaky skin, right?
Exactly. Yeah. We actually kind of almost call eczema leaky skin. People with eczema prone skin also have just genetically, they're missing certain proteins in the skin barrier. And so their skin is just unfortunately more compromised. And so it's easier for things to get into the skin because it's more leaky. And it's easier for bacteria, like unwanted bacteria, like staph bacteria, to hang out. So yes, there's definitely like a pattern or connection with leaky skin and leaky gut.
Okay. Okay. So there I was missing the boat on, of all people who should know what was happening, it would have been me, but I was not. Well, here's the third part. And this is really why I wanted to have you on, was this conversation about retinols and retinoids and what we should be doing as middle-aged women. I react really strongly to those. And that was all part of this mess that I made, was I was playing around and dabbling with I think a retinol product. I get cold sores. Even if I stay out of the oral area and I go
Hmm.
nowhere near my lips and I slug my lips with Vaseline first, I still get cold sores
Oh my
from
gosh.
retinol. And it's the weirdest thing. So anyway, I
Hmm.
have sort of had to give that up and I went to bakuchinol. Is that
Bakuchiol. Hmm.
bakuchiol? Anyway,
Yes.
I went to that. So maybe we could talk about
Hmm.
all of that, because I think that's probably something that my listeners are knee deep in and probably
Yeah.
don't know all the differences.
I know it can get so confusing because they all seem to sound the same, and then bakuchiol is just a crazy word. But I would say, yeah, retinoids is sort of like the overarching umbrella term of these vitamin A derivatives. And the reason why it's talked about so much and why derms love retinoids is because there is so much evidence, and we've seen it firsthand, how retinoids can improve skin health. One, by increasing your skin cell turnover, so it helps keep an even skin tone. It keeps your it keeps your pores clear. That's how it helps with acne. And then it works deeper on the collagen level to remodel collagen. And that's how it can help smooth out your skin and help diminish fine lines and wrinkles. And within the retinoid family, there's a lot of different types. And I think the one that we know most often are retinols, because that's the most commonly available over the counter. Retinols and retinaldehydes are the two, I think, most common that are over the counter. Retinol has to get converted into retinaldehyde, and then retinaldehyde gets converted to what's called retinoic acid, also known as tretinoin, which is the active form of a retinoid. And tretinoin is a prescription form. And there's cousins of tretinoin like tazarotene and adapalene. But those are the active forms. So those are going to be the most irritating as well. Whereas retinol and retinaldehydes could be less irritating. But there's still a lot of irritation potential with all of them. And then there's other precursors to retinols, but they're not as common and they're much more mild. And I would say it's interesting that you brought this up because it's such a commonly recommended ingredient or product by derms, but you have to be very cautious when you start getting to the menopause stage, because your skin barrier changes with less estrogen, you have less sebum, your epidermis gets thinner, and you have less hydration in your skin. And so I'm more cautious with women using a retinoid during um, at that time. I think it's still possible, but I think also with since you have this predisposition to rosacea and some sensitivity, um, I think that you need to take extra caution. I like bakuchiol. So bakuchiol is a plant alternative. Some people say it's like a plant retinol alternative. I just still don't think it compares to retinols and retinoids in general in terms of its efficacy. I think it's great. And I mean, I use it as a pregnant person. But it does some collagen remodeling, it does some skin cell turnover, but it's not to the same degree. But we like it because it's much more gentle. And yeah, there's other fun things too that you can use if you want to work on wrinkles.
I need a facelift.
Oh
I
no.
need all the things. No, I went straight to tretinoin. That's why
Ah.
and it was a disaster. And so,
Mm-hmm.
yeah, so I got off everything except for literally I was down to Vanity Cream, one product, and my Cicaplast. Like that's all I touched for probably a year. And I do estrone on my skin. I'm sorry, estriol. What am I thinking? I'll do estriol on my skin, and that's all good and fine. I have backed way up to just some weak over-the-counter retinol, and I don't know if it's doing anything. This is what I wanted to ask you. I get asked all these questions, and I'm like, I'm not a dermatologist. I don't know. There's a couple myths out there. One is that retinol thins your skin. I understand that to not be correct, but can you
That's a myth.
explain that
Yeah.
myth and why that's perpetuated?
Yeah. Well, yes, I do want to say that that myth is false. So don't worry, it does not thin your skin. But I could tell you why people think that. So, because retinoids work by increasing your skin cell turnover, it's focusing on that top layer of your skin barrier, which is your stratum corneum. And it can actually thin your stratum corneum. It regulates it so that it's a little bit more compact and you don't have like excess dead skin on your face. So that's what people are thinking when it potentially is making your skin thinner. But your epidermis as a whole, so the stratum corneum is just one layer. That's just the top layer of your epidermis. But your epidermis as a whole gets thicker, and your dermis, which is where your collagen sits, gets thicker too. So it's the opposite. Your skin gets thicker. And I think, people say, oh, but you have to like avoid the sun. You have to wear sunscreen when you're using a retinoid. Because yes, if you are changing your stratum corneum, there could be a little bit more sensitivity. I mean, it's part of your skin barrier, especially when you're first starting a retinoid and you're not regulating the skin cells, or the skin cells aren't regulated or at an equilibrium state. So your skin can be more sensitive to the sun. And yeah, it's always important to wear sun protection when you're using a retinoid. But your skin is going to be healthier and thicker.
Yes, that's what I understood it. And explain to the listeners kind of how the skin works, because I don't think most people realize that you've got multiple layers and they're constantly shedding out, and that sometimes that stratum corneum, things get kind of glommed up, like if you're hypothyroid, and there's
Exactly.
different situations where that upper layer just isn't sloughing off the way it should, and it's a balance that you have
Mhm.
to achieve, right?
Yes, exactly. Yeah, I mean, I would say that when we're the ages of like 9 through 12, that's like when our skin is perfect. Like, or actually, no, sorry, I'm thinking of a baby. You know when people say like smooth as a baby's bottom or smooth as a
Yeah.
baby's butt? Because babies have like the best cell turnover. Their cells are turning over faster than like every 30 days. And so that's why their skin is so smooth. And basically, there's three basic layers to the skin. There's the epidermis, dermis, and then the subcutaneous layer, which is where your fat is. And then below that is muscle. And in your epidermis, there's the basal layer, which is where they produce your keratinocytes. Keratinocytes is another word for your skin cells that are in the epidermis. And then as they rise up, depending on where you are in your body, there's different number of layers to go through, but you get to the top layer where essentially like the skin cells are dead and it's just the keratin, and that serves as part of your skin barrier, and your keratin is what naturally sloughs off. But like I said, as we get older, and also with like hormonal changes, thyroid issues, um, I'm trying to think of anything else that can play a role. It's mainly age and decrease in your hormones and thyroid that can play a role in your cell turnover.
I think metabolic health could be thrown in there too.
Yes, you're right. Like even people with like diabetes, we
Yeah, they
see
slow
like
down.
really slow, yeah, definitely slower cell turnover for sure. Yes. And so that's where things like exfoliants and retinoids can certainly help keep that turnover at a healthier rate.
Got it. So it keeps it in more of a homeostatic balance
Yes.
and in a good rate. What about the skin mantle? I know that in my world, we address skin issues via the mantle, via balancing fatty acids in the body. We might use fish oil. Sometimes fish oil makes people break out. It kind of depends, but that mantle is really important, and the acidity or pH of it, I should say, is important. Is that part of the skin barrier conversation?
That's exactly. It's part of the skin barrier. So it might be kind of confusing, but mantle essentially is the skin barrier.
Got it.
So I mentioned that the stratum corneum is part of the skin barrier, but there's other components like the acidity. So it's like the acid mantle is I think the term that's mainly used to refer to the acidity of your skin barrier. That's important. Our skin is naturally more acidic. So when you're using like harsh soaps, which are basic, which were more popular, 20, 30, 40, 70 years ago, those can totally disrupt your skin barrier because our skin wants to be more acidic. But so anyway, so there's the acid, there's the pH level, that's part of your skin barrier, and that's part of the mantle. The microbiome, so the bacteria that's on your skin is part of your skin barrier. And then the lipids, and it's the combination of like fatty acids, cholesterol, there's ceramides, there's a whole collection of them, that it's like you want that right ratio and balance and everything to kind of live together in an ecosystem.
Yes. So you can throw it off when you start throwing all these different topicals on top.
Exactly. Yeah. So like when people use like harsh antibacterial soaps and whatnot, that throws off, your microbiome, and that could throw off the pH, and that also strips can strip some of the sebum, like the oils. So, yeah.
It's easy to make a mess out of things. I think it's this right now, though, culturally, we're in this weird place with the internet where people, young girls are using like 13 steps.
Oh my gosh. That's why I was mentioning that age 9 through 12, where all these preteens are so obsessed with skincare. And I'm like, y'all, this is your skin's not going to get any better than this. Like, don't do anything to your skin, please, because this is like the best age. I mean, yes, some girls are going to, or, kids at that age can start noticing like increased oil production and some acne production, which I feel like we're seeing a little earlier, than starting earlier these days. But otherwise, yeah, just a gentle cleanser, moisturizer, SPF. You don't need to exfoliate. You don't need to use a retinoid. Sure, if you want to use like a fun hydrating serum, go for it. But you don't need peptides and all those other actives. Vitamin C, you don't need.
I even see women, I follow all these different accounts on Instagram of middle-aged and older women doing makeup too, because it's like that whole thing changes. Your makeup application strategy is completely different once everything starts drooping. So I've had to completely relearn that whole process. And it's wild. But even these women are putting 5 or 6 steps on before they even start with like a concealer or foundation. And I'm like, is it really? This all seems very complicated and unnecessary.
It's unnecessary. I kind of get the appeal as like a self-proclaimed skincare junkie. I do get it. But it's unnecessary and potentially can be harmful. So it's something that derms usually advise against, because we end up seeing more issues when you're introducing more ingredients to your skin, and a lot of products can have a lot of overlap. So it's either excessive, which can lead to irritation, or excessive, unnecessary, and expensive. When it comes to somebody who is an adult woman, I recommend some kind of antioxidant serum in the morning. Vitamin C is the most well-studied antioxidant out there. So that's why we recommend it all the time. And then follow that with a moisturizer and then a sunscreen, or use a sunscreen that already has a moisturizer in it. You don't have to use too many products in the morning. Yeah.
And just keep it simple.
Keep it simple. Yeah.
And then what does nighttime look like? If you're going to use your antioxidant or vitamin C serum in the morning, what would you suggest as like an active for nighttime?
Usually at night. So in the morning, we recommend products like an antioxidant, because that's going to defend your skin against the oxidizing, elements of our environment, whether it is UV rays, pollution, and then of course sunscreen also helps protect against that. And then at night is when our skin goes more so in repair mode. So our skin cells are actually working a lot at night. And also we tend to lose, or water evaporates more readily at night too. So that's when you want to use you want to use actives to help with the repair work, but you also want to really seal with a more, I guess, a thick or effective moisturizer. That's when you can use heavier things if your skin tolerates it. But the main active, so we recommend, I'm a fan of double cleansing. So, some people, I mean, if you at least cleanse your face once, that's a huge win, because cleansing your face is such an underrated step. People think like, yeah, I mean, duh, like cleansing your face, but really it's so important to remove all the things that you're exposed to during the day. We live in a crazy world with a lot of pollution. So washing your face, and if you wear sunscreen and makeup, like I am a fan of double cleansing, like using some kind of oil-based cleanser first, followed that by like a gentle cleanser. Once again, you don't have to do that. Washing your face with one product, like if you can do that, we're happy. And then when it comes to actives, the main one we do recommend at night is a retinoid. And then you follow that with a moisturizer. Now, there's, like I mentioned earlier, if you can't tolerate a retinoid, there are other things out there. We talked about bakuchiol, but there's also peptides that can increase collagen production, growth factors, stem cells, like other antioxidants. And you could use vitamin C at night too. Like that can help do some collagen remodeling as well. But I think you get a lot of bang for your buck if you use it in the morning too.
Okay, that makes sense. That keeps it simple. Let me back up a second. The double cleansing. I use a balm, I love Clinique has a balm, a cleansing balm that is like I've tried. I turned into a skincare junkie during this whole process, trying to figure out what worked and what didn't work. And I probably spent way too much money, but that one I think is my favorite because it gets a little bit milky when you add water to it. So it's awesome. And then I follow that up with either a CeraVe cleanser, or like a cream cleanser, or the La Roche-Posay has one that's a cream cleanser. Anyway, all that to say, I cannot get my makeup off if I skip the balm. Like there's enough. And I don't put hardly any makeup on, but I really am with you. I think the double cleanse is the way to go. And it's so, it's such a wonderful ritual. Like it feels so good. I use it as a chance to massage my face and give myself some lymphatic drainage and like really make it luxurious at night. And it's my little ritual at night, and it just takes the day away.
Yeah, no, I think we don't realize how much that's huge when it comes to dissolving makeup, sunscreen, that you need that oil property actually. But it's important to follow that with a regular cleanser, because some people the oil component can cause them to break out. So that's why we say to use a second cleanser after that.
Yeah, for sure. It's great. I used to just use oil cleansers by themselves, and then I started breaking out because I did not know what I was doing. So I'm glad you said that, because it all seems so simple, but it took me a hot minute. I was like a total newbie novice, and here I am, online, and I'm supposed to be this influencer, and I'm like, I do not, everyone's like, what do you do for your skin? I'm like, I have no idea. Good nutrition. I mean, that's really, I think your best skin secret is good nutrition and good health. But when I started dabbling, I sure did make a mess of things. So.
Well, your skin looks great.
Thank you.
From what I can see.
It's good now. It's good now. And I am back to holding to that. When my skin breaks out or when my skin acts funny, something is wrong internally. I immediately go to an internal check. Like, where are my hormones at? Where am I in my cycle this month? What's my stress level been like? What's my sleep been like? What have I been eating or not eating, enough of? And it's just a quick tally of like, okay, here's something is causing a disrupt. It's like there's a disruption in the force, if you will. Like that's how I think of it, So, I'll throw in the magic bullet that I have seen time and time again. And as I've mentioned to my listeners, and they've responded back to me, because you and I are in unique positions. We have a lot of followers. We have a lot of people who give us information. So even if we're not seeing it in our clinical practice directly, we're hearing, right, from people. Microdose GLP-1s are amazing for acne. So something to consider.
Yes. So, yes, you know what? I really want to, and I know because I feel like you're the guru of microdosing GLP-1s, but that's something I really would love to incorporate into my practice. There are some derms who are doing that, which is great
It
because we
works
do
great.
see, yes, we do. There's some skin issues where they benefit from like the regular dose of GLP-1, like psoriasis and
Mm-hmm.
but yeah, I would love to explore that for sure.
It's just, a microdose is just anything subclinical. So like anything below the standard starting dose, because not, someone like you or I is not going to tolerate the standard dose. It's too much. And so this is where that idea came from. But it really depends on the patient and what dose they tolerate. But sometimes just the tiniest little droplet will, and that was the whole intention of the microdosing for those who are just new to listening to me. It was never a weight loss strategy. In fact, it's not a successful weight loss strategy. It was always meant as an immunomodulator in my world. Like that's always what I was trying it for. And I think it's because we're getting a double whammy. It directly mitigates the immune system, which is part of the acne issue, but it is also directly mitigating the metabolic health and the insulin issue. So that, which is, low key PCOS. A lot of women are rocking low key PCOS and not even aware of it. And it's manifesting as acne and skin issues. So, and
Nice.
the neurologic benefits are profound. And so I've seen like, it helps with that, those of us who are sort of a little bit neurodivergent, a little bit ADHD, it helps assist with that too. And so, and I think it's all part of that inflammatory response that we're all rocking. We get low key neuroinflammation, our OCD gets worse, or whatever it is that whatever people are dealing with. But I think of gut and skin and hormone, all of it goes together, right? And so
totally.
GLP-1s kind of blanket across the board. I will say though, that even with microdosing, I've seen GLP-1s definitely, we have literature on this. They can very much end up in SIBO because we're slowing gut peristalsis. And so this is something that I haven't talked about it anywhere yet, but I am like knee deep in the research on this because it flared my SIBO. And when my SIBO flares, I get pain. I get chronic pain. And so my skin reacts and then my joints react, and it's all the same thing. So I think that the GLP-1 conversation, and this is something I talk about inside my course and I've talked about on my podcast, is like we have to support the gut. But what does that mean? That's a whole other conversation, and that's a deep conversation. But I do think that could be problematic. So keep an eye, because that's going to make the skin worse ultimately. And here's the terrible part about higher dose GLP-1s. If they are leading to SIBO in an individual or worsening someone's underlying SIBO, SIBO ultimately drives insulin resistance and obesity. So like, this is why I'm not a fan of high dose GLP-1s. Anyway, that's my tangent.
I think that's such a great point. So yeah, I'm glad you're bringing that up and I remember our conversation on our podcast too. It's like, you got to also make sure other things are optimized before even getting on GLP-1s or while you're on GLP-1s, because it can potentially bring out unwanted things too.
And SIBO definitely worsens skin conditions of all sorts I've seen. From like psoriasis to acne to eczema and all of it. So So anyway, it's like, I'm sure, well, I was looking at actually low dose. I took a lot of, what was it, erythromycin when I was a teenager.
Oh yeah, they used to do that back then.
Yes, and they don't anymore, which I want to ask you about. But I just wanted to say this. I was looking at low dose erythromycin. It's a prokinetic, and at 50 milligrams, they use it to stimulate peristalsis in SIBO patients, because we got to get that motor complex going. We've got to get peristalsis going.
Yes.
But it can, again, it's like the treatment can worsen the condition long term. And so anyway, that got me thinking about my years on erythromycin. What was that about, and why did they stop doing it?
Well, yeah, erythromycin was a commonly used antibiotic for acne back in the day, more so in like I would say more so in the 90s. And the reason why we don't do it anymore is because there was just so much resistance that got developed to erythromycin. Yeah. So then they switched to like the tetracyclines, like doxycycline. But I'm happy. I feel like there's this movement more so away towards antibiotics in general, just because we're just seeing a lot of the long-term issues, the gut issues. And I'm hoping that there's less and less, but We still use it a lot, unfortunately.
Well,
Antibiotics are used a lot.
all those antibiotics you just mentioned all mitigate the immune system in some way or another. So we
They
use,
do, yeah.
which I wonder how much of it is the actual killing off of bacteria versus is it just working as an immune modulator, and that's what's helping the skin clear.
Right. Yeah, exactly. So that's why we love doxycycline, because we're like, if it's like it can help if it's inflammatory or if it's bacterial. So we'll use it a lot in those situations. And I even know of a derm. She's a pretty big derm who will take the low dose doxycycline because of its anti-inflammatory effects. Like she takes that daily as part of her anti-aging strategy.
Yep. Yep. No, it's a thing. And again, though, if you've got low key SIBO, it's a hard one because
it's a hard one.
I go
I've
on
seen people get UTIs with low dose doxy.
Oh no, that's rough. I feel amazing on doxy.
It's good stuff. I know. I've had to take it as prophylaxis for stuff, and I was like, "This is great."
Yeah, I feel so good on it because it's that low key SIBO kind of driving I don't know. It's such a mess. So interesting. Okay, let's go back to retinoids for a second because I know a lot of women want to use them. What would be a good onboarding strategy that you might suggest for the general public if they're maybe concerned about sensitivity or they've had reactions like I have?
Yeah, I would look for. I would probably not do a prescription retinoid, and and there are different retinols and retinols over the counter that are great for sensitive skin. And I know I'm like I could throw brands out there.
Oh, you don't have to. I think over the counter, like a retinol over the counter is going to be fairly gentle, right? And they're
going to be fairly gentle, but there's a wide range too. Like some are because it depends on the percentage of retinol, and you don't even see that on the packaging too. So it's like it's hard, but usually with drugstore retinols, they're pretinols gentle.
And you can do that sandwich technique where you put on
exactly.
Talk about that.
So when starting with a retinoid or retinol, you definitely want to be BFFs with a moisturizer. We typically tell people when starting with a retinoid to use just a pea-sized amount, and it doesn't seem like a lot, a pea-sized or a chocolate chip amount. It's so funny. Some Gen Z people, they don't know what a pea size is when you're telling them, and it's like, I don't know, I guess people aren't eating peas as much these days. Anyways, a green pea size amount or a chocolate chip, and you're going to dab it in 5 places. I usually say forehead, nose, cheeks, and chin. And then you rub it in. It seems like it's not doing anything because it seems like such a small amount, but it does. And I tell people to start it 2 to 3 times a week. You're going to follow that with a moisturizer. Now, if you're doing that, if you're doing it 2 nights a week or 3 nights a week, followed by a moisturizer, and you're still noticing dryness or potential irritation, you could do what you brought up. It's the sandwich method, the retinoid sandwich, where you start with a moisturizer as a base or a buffer. Then you use your pea-sized amount of your retinoid all over, and then you sandwich it with another layer of moisturizer. And, if you can tolerate that 2 or 3 nights a week, the goal is to eventually get to 5 to 7 nights a week. You don't have to necessarily get to every day, 7 nights a week, but if you can do even 5 nights, 6 nights a week, that's the goal. Now, if you're still irritated, and you're I just spent all this money on this retinol, I don't want to throw it away. There's something called short contact therapy, where you just, when you come home from work or whatever, it's still 4 or 5 p.m. or 6 p.m., you can put your retinoid on top of your makeup, really, and leave it on your face for, until you wash your face for that night. So
smart.
4 or 5 hours. So that's why the other thing too, we tell people don't use it on damp skin. I mean, if you have a moisturizer, there is that kind of more buffered thick layer, but if you use it on damp skin, there's a higher chance for irritation because it'll penetrate even more effectively. So use it on dry skin. Like I said, if that doesn't work, then do the the retinoid sandwich.
I love this idea of the short. What did you call that?
I call it short contact therapy. Mm-hmm.
I love that. That's a great idea. I have a whole cabinet full of expensive retinoids
Retinoids. Yeah.
that I was like, and I'm moving, right? So I'm purging and I'm like, should I throw all of these away? Because they like these were okay and those were not okay. But I think that you're on, because what I wanted to ask the last thing was, I have heard, and is this a myth, that you have to actually use it enough for it to be useful? That if you're only able to tolerate it once or twice a week, you might not really be getting anywhere. Is that, how do you feel about that?
I agree with that, actually. I think you want to try to get to 5 nights a week if you can. The 3 nights a week is more just like the on-ramping process. So if you really can't get past 3 nights a week doing like the moisturizer sandwich or even the short contact therapy, then you probably should switch your retinoid to something even more gentle.
Okay, so you want to, so what I'm understanding is a gentler version or short contact method or whatever it is so that you can get more days in.
Exactly.
Is going to be preferable to you trying to like duke it out with something harsher 1 to 2 or 3 times a week and not really getting anywhere.
Correct.
Okay.
Yeah.
Okay.
The studies have been done with it being used pretty much almost every day.
And I think it was you who taught me that, because I remember you doing, I think it was you did a reel about kind of that, like backing up on intensity. Because if you're, sitting there with a tretinoin and you're like, I'm going to make this work, I'm going to get through this, like you're not doing yourself any favors if you can only handle it once or twice a week.
Exactly. But the thing about retinoids is that in many people, your skin can learn to tolerate it over time. So like once you're done with it, like if I wouldn't force it, but if you're using a gentle retinol and you're doing great with it and you're done with the tube or bottle, then consider stepping it up slightly with your next one, and gradually marching up.
Okay, so it's a slow and steady.
Slow and steady, for sure.
We're microdosing retinoids.
Exactly. I know. I love how microdosing is like the phrase of 2020, of the 2020s.
Oh my gosh. Well, so there's this concept in naturopathic medicine. It's German medicine, actually, of low dosing, where you use the low, and this makes sense, and it makes sense in your world. You use the lowest effective minimal dose to get the therapeutic outcome you're looking for. And that might be below the standard starting dose. That's why we have compounding pharmacies, for anything, right? And so we just made the point with this retinoids. It's like sometimes you got to start with the gentler, kinder version, and you can step yourself up as tolerance builds. And some people don't even need to go there necessarily, right? And so that's the idea, but I don't know a better word for it, because when people think low dose, they think that there's low dose, and then there's this world far below that can still be effective for people in all different kinds of medications. Like it's not just, it could be the case for supplements or even herbs. It's just whatever the individual tolerates, and you have to do it. This is all individualized. I think your industry really does understand that concept of individualized medicine. Like because the skin is not going to mess around. It's going to respond exactly how it wants to respond. You have to sort of meet it.
Can be so personalized. That's why I sometimes have a hard time, even with social media, like giving like blanket advice, because I'm like, well, it will also ultimately depend on your skin type too.
Yes.
But yes, it is very personalized.
So does this funny perimenopausal skin situation balance itself out in when women become postmenopausal? Or does it get worse?
Okay, so it usually gets worse. I'm sorry to say that.
Great.
In terms of crazy ups and downs, you're not going to see that. Like I think perimenopause is when I see people are like, why the hell do I have acne right now? Like why is my skin more oily? Like shouldn't it be getting more dry? And there's more like craziness. So you're not going to experience as many roller coasters once you're substantially in the postmenopausal period, but because unless you're doing like HRT, that low estrogen, it results in, like I said earlier, thinner epidermis. You have less hyaluronic acid in your skin, so your skin's less plump, your collagen's less plump, your skin barrier is weaker. you have less lipids. So, so that you have the thinner epidermis shows up as like that crepiness, that like kind of tissue paper, the thin wrinkled skin. So yeah.
The turgor, you lose the turgor when you lose the
lose
estrogen.
Totally. Yeah. And some more so than others. It's interesting. I see such a wide range. But it happens postmenopausal.
Well, something I was taught by my mentor was if your skin is getting wrinkly, you can bet your bones are too. So I believe that if your skin really is showing itself, like I went through an abrupt aging situation right around that time that my skin was acting crazy. And I think that study that came out last year showed, it's around 44 and then again around 60. I went through like a definite marked aging, but I was under a lot of stress too. So who knows, but it happened and everything changed. I looked different. Everything changed overnight. And, I started to notice that thinning of the skin and I was like, oh, heck no, give me the hormones.
Yeah. Yeah.
More please. Cause
let me tell you, like I'm pregnant right now and I'm one of those weirdos who really likes being pregnant because I just feel like my hormones are optimized. I'm like, being in my 40s, I'm like, actually, I kind of need this right now.
Yeah. Well, you look glowing and gorgeous. So,
oh, thank you.
Yes.
But yeah, it's huge. The hormones play a really big role with the skin.
Yes, 100%. I've had patients, my patients taught me, I had these little old lady patients that were so beautiful. And I will tell you, the ones who aged really, really well, because I got to follow my mentor's patients. They weren't just mine. I got to follow some women for 20, 25 years. I knew them in practice. And the ones that did the best were all on HRT. And it maybe wasn't all of it. Some of them were just on progesterone and they swore that's what made their skin beautiful. Some of them were on progesterone and some testosterone. Some were they love their estrogen. It really, depends. I mean, they always took progesterone on top of it, but it was anyone's guess what their HRT consisted of. Always some thyroid usually. And that was kind of the cocktail. And they all did, and they were all very active. And they all knew if they stopped moving, they were going to lose the ability to move. And they all knew that their nutrition was paramount to keep their brain in good health. And so I'm guessing that's probably who are your most beautiful aged patients too.
Yeah. Yeah. I can tell who's on HRT. And it definitely helps for sure.
Yeah. Yeah. Mm-hmm. And then the cognition part is right there with it. I watched cognition decline abruptly in my patients who chose not to go on HRT. And it just is this slow, and it's really subtle. But what I would say is if there's things that you could do 5 years ago, like mathematically, that you can no longer do, or your stress tolerance is running out too quickly. I notice this a lot in perimenopausal women. They start to feel crazy and it's not just forgetful. It's like, I'm a boss babe. I can run, I can have 10 plates in the air and now they're all crashing down around me and I can only do one thing at a time. And oh, what were you saying? And oh, why did I go in this room? Think about HRT, ladies. It's a sign.
Yep. Mm-hmm. Yeah, right. It's like you just don't feel like yourself. Like that's one of the first signs.
Yeah, and pay attention to your skin because if it's acting crazy, there's probably some stuff going on. So, okay. Well, anything else? Any other tidbits of info that you want to leave the listeners with?
I would say that I mentioned this earlier, if you can't tolerate a retinoid, and I'm more so to recommend this for postmenopausal women, is there are still other things out there that can help build collagen. So don't lose hope. Or you could use them in addition to retinoids. Like I think that if you are postmenopausal, looking for a moisturizer that's incorporating peptides, like a multifunctional moisturizer, or antioxidants in a moisturizer, growth factors. So there's other things out there.
Yes. And we'll have you on again, but when you come back, we're going to talk about microneedling and other things that people can do, because I'm sure there's like a whole other world
that stimulate collagen.
Yes. That's part
Definitely. 2. Yes.
That's where I'm headed next. I'm moving to Arizona and I swear there's like a laser aesthetic clinic, literally like 2 or 3 in every mini mall there. I mean, apparently.
It's the Mecca. There's a lot of aesthetics.
Yeah, so I'm gonna get down there and find some lasers, and
you won't have a hard time.
I'm gonna call you and ask you what should I do to this?
Yes,
and then we'll have you on the pod and talk about it.
Let's do it.
Okay.
Sure.
Well, Dr. Mamina, where can everyone find you and all the wonderful resources that you have?
Yes. So you can find me at dr.mamina, dr.mamina on Instagram, TikTok, YouTube. I also have a website, drmamina.com. I'm a co-author on a book called The Holistic Psoriasis Management and Nutrition Guide. So for those who are dealing with psoriasis, and we go through all the conventional medications that are available that a dermatologist would prescribe. But in addition to that, we go through all the data that's out there for other environmental factors and supplements that play a role or could be helpful for psoriasis, as well as a
Amazing.
nutrition guide. So
I need to read
yes.
that. I have psoriasis. So
Oh, okay. Yes. Yeah. It's on Amazon I don't know, I feel like it's been on sale on Amazon for the last year. It actually just
amazing.
got released in April. So yes. And then, that's how you can find me. And yeah, I'm all about this stuff.
Okay. I will put the links everywhere because your content is so great. Your
Oh,
TikTok and your
thank you.
Instagram are they have helped me so much. So thank you
I'm so
for,
glad.
yes, it's been a journey. Like I said, I had no idea. I grew up in a hair salon. You'd think I would have known, but somewhere along the line, just, everything is different when you're over 45. That's all I have to say.
Things definitely change. Yes.
Yes. Well, so fun to talk to you, and we'll have you back on and we'll have you come in person after you have your baby
Yes.
and you'll come to
Would love
Arizona.
that.
Okay.
Yes.
All right. Thanks, lady,
Definitely.
for coming on the show.
Thanks so much for having me.
Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.